All right, good morning, everybody. Thank you for joining us. This morning we have the honor and pleasure of having Dr. Jennifer Manegold present to us today on reflective parenting. I want to give a little bit of introduction about her background. So she's currently a second-year child and adolescent fellow at UCLA. She graduated with a BS in biochemistry and cell biology and an MS in biology from University of California, San Diego. She received her MD from the UCLA David Giffen School of Medicine, so locally, and I didn't know this, she completed a T32 NIH training program in neurobehavioral genetics with a focus on the genetic underpinnings of perinatal depression. She completed her psychiatry residency also at UCLA, the Semel Institute, with a concentration on community psychiatry and global mental health, and also served as chief resident in the community and global mental health psychiatry track in her third year, and as program chief resident in her fourth year. During her residency, she pursued subspecialty training in reproductive psychiatry with the UCLA Women's Health Clinic and at the VA Women's Comprehensive Care Clinic. As a child and adolescent psychiatry fellow, she's merged her interests in perinatal psychiatry with early development and worked with recent graduate Patricia Saki to develop a parent-infant mental health area of distinction, which I continue to hear rave reviews about from folks who are currently in that track. So without further ado, Dr. Jennifer Manegold.
Thank you so much for that introduction. So let me get this started. So the title of my talk today is Fostering Connection with Reflective Parenting. I do not have any disclosures, and a reminder to please submit any questions you have throughout the conversation in the Q&A box. You don't have to wait till the end, but they will be answered at the end of the presentation. So just to give an outline, we'll start with the foundations of reflective parenting and its theoretical roots in attachment theory, mentalization, and reflective functioning. I'll give a really rapid overview of brain development and the role of relationships. Then we'll talk about the principles of reflective parenting and its clinical applications. And finally, some considerations for working with foster and adoptive families. First, some background. Reflective parenting is a relationship-focused approach to parenting. And we know that children with a strong relationship with their parent or caregiver just do better long-term. And that's in terms of their physical and mental health, and in terms of social, academic, and independent functioning. So reflective parenting is based on the premise that the parent-child relationship is paramount. And when we think about the goal of parenting as helping the child develop into a competent adult, all the lessons that lead up to this are best taught through the parent-child relationship. So that's social lessons as well as non-social lessons. These are all passed from parent to child in a relational way. And reflective parenting is a style of parenting that's really focused on relating and responding to the child in a way that takes into account what is going on in their child's mind, as well as being aware of what's going on in their own mind and how this impacts the child. And again, it's built on multiple theoretical frameworks, including attachment theory, mentalization, and reflective functioning. So just a very quick overview of attachment theory based on foundational work by John Bowlby, Mary Ainsworth, among others. Infants have an innate, evolutionarily driven predisposition to seek safety and care from the primary caregiver or their attachment figure. The child seeks their attachment figure when they feel threatened or in need of comfort, or when they wish to explore safely. And this relationship between the infant and attachment figure is really vital to the social and emotional development and becomes a template for future relationships far down the line. And a secure attachment develops when the caregiver responds sensitively to an infant's needs. Then the secure infant uses the primary caregiver as a safe base from which to explore the world. And then mentalization is the ability to see a person's actions as driven by internal beliefs, desires, feelings, motivation. Its roots go back to theory of mind, which is a concept that dates back at least as far as Descartes. And then it really emerged in psychoanalytic literature around the 60s. Then Peter Fonagy and his colleagues applied this to attachment theory and developmental psychopathology in understanding how development of mentalization goes awry. And this ability to mentalize develops in early relationships. It's rooted in the caregiver's ability to accurately reflect thoughts and feelings. So the caregiver understands the mental state of the child and mirrors this back to the child. The child then gains an understanding of their internal state and learns to manage their emotions. And then reflective functioning is really closely linked with mentalization. Peter Fonagy defines it as the uniquely human capacity to make sense of each other. It's understanding that one's own and others' behaviors are driven by internal feelings, desires, beliefs, motivations. There's understanding that everyone has a mind that is subjective, separate, and private. And what goes on in one person's mind may be the same or different from what is going on in someone else's mind. And so this takes us to reflective parenting, which is at its core relationship focused. It involves the parents' use of their reflective capacity in all aspects of their relationship with the child. And this is really important because a parent's reflective functioning is the best predictor of a strong parent-child relationship. So reflective parenting is a style of parenting that is focused on relating to and responding to the child in a way that takes into account what is going on in their child's mind, as well as being aware of what's going on in their own mind and how this impacts their child. So in its essence, being a reflective parent means being flexible, understanding, and accepting of the child and who the child is, and for the parent to be accepting of who they are as a parent. So understanding that this is dyadic, it involves two people, which sometimes in parenting approaches, we become so focused on the child that we really leave out the parent, and this really emphasizes the importance there. And this can be applied at any age or developmental stage to enhance the parent-child relationship, to really help the parent feel less stressed, more competent, and more confident about who they are as a parent and not being so preoccupied with what's the right thing to do in any given moment. Because one of the key principles is there is no one right way to do things. This allows parents to be themselves, allows kids to be themselves, and really uses this two-way process of what's the meaning of my child's behavior, what's going on in my child, as well as what's going on in me. Why am I responding this way as a parent? So next we'll dive into brain development, or a very extremely oversimplified version of it, and the role of relationships. So as this audience knows very well, brain development continues until age 25. But we see the largest spurts of brain growth occurring during gestation, during infancy, and then again in adolescence. So this graphic is to represent how at birth, the brain weighs about 400 grams, or 25% of its adult weight, approximately. By age 3, the brain almost triples in size to 1,100 grams, reaching about 70% of its adult weight. And then by age 5, it's around 90%. By age 25, it's at about its adult weight of 1,500 grams. And I say this in part to emphasize that infant development is a critical period of growth and development, and it sets the stage for all later growth and development. And this is from Bruce Perry's neurosequential model. Right, the brain develops in a sequential and hierarchical fashion. This occurs in a bottom-up kind of fashion, so meaning least complex areas to the most complex areas, from the brainstem to the cortex. So looking at the brainstem as responsible for vital functions, breathing, heart rate, sleep, regulation, fight, flight, or freeze. The midbrain is coordination and movement, limbic system, critical for emotions and memory, cortical areas for higher level functions, empathy, impulse control, and literacy. And then, so this can be helpful to map this onto what Bruce Perry calls the 3 R's. So the bottom part of the brain responsible for regulating, the middle for relating, and the top for reasoning and reflection. And you really need the regulation in order to relate. To relate, it's necessary to be able to reason and reflect. And then brain development really depends on relationships. So as Daniel Siegel says, human connections shape the neural connections from which the mind emerges. And genes provide a basic sketch of where neurons and their connections should go. Experience tailors those neurons and connections and individualizes a child's brain. So a child learns through experiences, through repeated experiences. We strengthen neuronal connections, and meanwhile, pathways that aren't used get pruned away. And we know that infants are hardwired for interactions. The parent-infant relationship is vital to the baby's existence in a very literal way. The newborn is wholly dependent on caregivers for feeding, for changing, for staying warm, being protected. It's vital for emotional development, vital for building a foundation for all future relationships. And infants learn socially. Even non-social behaviors like how to eat are learned through social relationships. And learning occurs through internalizing the parent-child relationship. It's not just what the parent tells them, but how the parent relates to the child that counts the most. And infants learn through serve and return interactions. This will be a test if I set it up properly.
The key to
Oh, shoot.
forming strong brain architecture is what's known as serve and return interaction with adults. In this developmental game, new neural connections form in the brain as young children instinctively serve through babbling, facial expressions, and gestures. And adults return the serve, responding in a very directed, meaningful way. It starts very early in life, when a baby coos and the adult interacts and directs the baby's attention to a face or hand. This interaction forms the foundation of brain architecture upon which all future development will be built. It helps create neural connections between all the different areas of the brain, building the emotional and cognitive skills children need in life. For example, here's how it works for literacy and language skills. When the baby sees an object, the adult says its name. This makes connections in the baby's brain between particular sounds and their corresponding objects. Later, adults show young children that those objects and sounds can also be represented by marks on a page. With continued support from adults, children then learn how to decipher writing and eventually to write themselves. Each stage builds on what came before. Ensuring that children have adult caregivers who consistently engage in serve and return interaction, beginning in infancy, builds a foundation in the brain for all the learning, behavior, and health that follow.
And I also just want to note that I'm emphasizing infant brain development in particular because it is such a critical and foundational developmental period. But of course, it's not the end all be all of development or of the parent-child relationship. The rest of development still matters, obviously. This audience knows that well. So from age 3 to 11, there is slower maturation that enables the child to develop greater accuracy, coordination, and self-control, language skills, memory, recognition of causality also develop, and the maturation of prefrontal circuits enables the development of impulse control. And the parent-child relationship matters here too, even though I'm not focusing on it as much. And then thinking about the adolescent brain, it goes through a third wave of exuberant overgrowth. And this presents another important opportunity to strengthen the parent-child relationship. So just some things that we know about the adolescent brain. impulsivity, emotional reactivity, novelty seeking, risk taking. These are important for allowing the teen to have new experiences and learn new information needed to become an independent adult. And also important to note, this puts a lot of strain on the parent-child relationship. There's also an emphasis on peer relationships. And this is important because peers are the ones who will go with them into adulthood. These relationships help them survive the very stressful process of growing up. And the social and emotional brain matures earlier than prefrontal control centers. So there's this difficulty in containing social emotional impulses and feelings. As we all know, teens are highly sensitive to social feedback. They're on high alert for being judged. And these intense peer relationships are important for building social skills needed to navigate future relationships. The reward circuitry also gets remodeled in the adolescent brain. So there's a greater dopamine response to novelty and emotionally intense situations. And reward seeking precedes the ability to regulate behavior and the ability to grasp long-term consequences. So all these changes pose challenges to the parent-child relationship and can be very difficult for parents. So it's really important to emphasize that the parent-child relationship is still of utmost importance. So it's important for parents to be able to take the perspective that this is a necessary step in development, especially when they're feeling hurt or rejected by the teen or getting kind of tired of the drama. It's important for a parent to validate and empathize with the pains that their teen experiences and remember that this will get better. And helpful for us to remind parents too that the teen may see the risks, but the rewards are perceived as even greater. And the teens still need the parents to worry about them. Just important to balance this with the perspective that pursuing rewards and risk is what will move them toward independence. And teens need to feel safe enough to take risks and even fail. And part of that comes from that safety of the relationship too. So after that whirlwind, we'll go into principles of reflective parenting and its clinical applications. So with reflective parenting, again, some of the goals or benefits are to improve mentalization. It improves the child's ability to self-regulate. It helps buffer the child from negative experiences and helps the child develop skills needed for establishing and maintaining relationships. And there's some specific techniques that help achieve these goals. So one of these mind-mindedness or mind-minded statements is a term that comes up in reflective parenting. And these acknowledge that the child has a mind containing thoughts and feelings, acknowledge that the child's mind is separate from the caregiver's mind, and that the caregiver, making these statements allows the caregiver to tell the child about his mind. And all of this serves to link the child's feelings to the outside world. And through this, the child learns to understand himself, the outside world, and how these are connected. So one example would be, the baby cries, mom approaches and asks, does mom need to change her diaper? It's not very comfy, is it? And stating this out loud shows the link to the baby's feelings, to the physical world, and is the beginnings of how the baby learns to understand himself, the outside world, and how these are connected. Another kind of technique or term that we use is mirroring. So this is where the caregiver's facial expression and tone of voice match the baby's feelings. The baby sees his feelings reflected through facial expression or tone of voice. And this is how the baby starts to learn about how he feels in the beginning stages of learning to manage feelings. It's really important for the baby to have an adult interested in him in order to develop these skills. I think we can even think of this in adult life, where you think about the difference between telling a friend a story when the friend is fully attentive, engaged, reacting, versus talking to a friend who's distracted, maybe looking at their phone or preoccupied with something else that happened. And when you're in that conversation, you might try to up the level of drama, become more animated in order to try to draw them in, or the opposite. You might just shut down completely, stop trying altogether, withdraw, go to your phone. This kind of thing happens with the baby, and it's really key in order to develop these skills that they have that interested caregiver. And so parental reflective functioning, we think about its influences in terms of past experiences, particularly how the parent was parented. So Ghosts and Angels in the Nursery. Ghosts in the Nursery was written by Selma Freyberg, 1975, and details how our negative and traumatic experiences of being parented can really resurface in the transition to parenthood and caring for an infant, and create difficulties in that parent-infant relationship. And then more recently, Angels in the Nursery, published by Lieberman and other colleagues at UCSF in 2005, really shows how our positive experiences of being parented also resurface in this transition and can be a source of strength and connection in this same relationship. We also think about just what's going on in the here and now. This can be things like different life events that are impacting where the parent is at, sleep deprivation, physical health, or like other kind of physiologic things, mental health, emotions that are arising both from inside the relationship and outside the parent-child relationship also have a big impact on the parent's ability to reflect, to see things from different points of view, to see even their own point of view and how that's impacting them, because stress really impairs reflective capacity. And I think we've probably all experienced that. When we're more stressed, it's harder to think more openly and more flexibly. And one other important thing to know is that mentalizing occurs most of the time without us even thinking about it. And even when it's unconscious, we do it well about 30% of the time. In order to strengthen this, though, that's where this kind of practice comes in, being more intentional, really working on strengthening this muscle for parents through a reflective parenting practice. And in terms of its clinical applications, there are structured group sessions for parents that really focus on enhancing reflective functioning. So these can range from around 8 to 12 sessions in length. Sometimes there's the use of video to help parents see themselves from the outside. That can be incorporated into these group sessions, and really different skills are taught to enhance reflective functioning. There's also the home visiting model called Minding the Baby, developed by Arietta Slade at Yale Child Study Center. And this has been used in the US and in other countries, including England, Scotland, Denmark. There's an adapted version that's been used in Brazil, and it's an intensive interdisciplinary home visiting model. And this is really more for high-risk families where there is a greater risk that there will be greater difficulties in that parent-child relationship. And then it can also be incorporated into individual and dyadic visits, just using reflective parenting principles and helping individual parents become more reflective in their relationship with their child. And that's more the focus of what I wanted to bring up today. So starting with just some principles of reflective parenting, and these are adapted from The Reflective Parent by Regina Pally. So the parent-child relationship is paramount. There is no perfect parent and no perfect way to parent. You want to be curious, open-minded, and flexible. See the world from the child's perspective as well as one's own. Tolerate ambiguity and uncertainty. Regulate children by holding their feelings and holding the line. So really emphasizing the importance of both the empathy, being able to be the container for their feelings, but also to be the one to set the limits. That's also the role of the parent. Be more positive than negative. Repair ruptures when they do occur, because that is expected. Again, no one's perfect. No relationship is perfect. Ruptures are expected to happen. And then it's really important to repair these when they do happen. And then all kids are unique, so parenting must be adjusted to a child's specific needs. I think the other part of this is all parents are unique. They also need to be able to do this in a way that's authentic to themselves. It doesn't mean having to adapt to someone else's model or to someone else's rules. And so just some steps to take toward reflection. First is to pause and slow down. So anytime the parent has a strong reaction, this is a really great opportunity to pause and slow down, to be present in the moment, and start with curiosity. So this is a non-judgmental curiosity, both toward the parent. So for the parent to say, I'm having a strong reaction, what is that about? And then also being curious about the child, what is happening in them? What are they doing? How is that impacting me? How is my reaction impacting them? And you want to observe the child's behavior and label it with words. Really describe the behavior in more objective terms without adding in any assumptions. And then reflect on the meaning here. So this is reflecting on the meaning of the child's behavior, where is the child coming from, but also reflecting on meaning in terms of like where the parent is coming from too. And then all of this can be used to help guide the parent's response. And so just to provide some more like tangible or concrete tools, this is from the Reflective Parenting book by Alistair Cooper and Sheila Redfern. So this is familiar, I'm sure, to many people here who work with children. The emotional thermometer, it's used in so many psychotherapy protocols for developing emotional awareness and regulation skills as a way to gauge the intensity of feelings. And in reflective parenting, we use this as a way to guide us as far as when to act versus when to wait. So one of the principles that comes up in reflective parenting is learning to strike when the iron is warm. When it's too hot, they're being too reactive, it's too hard to reflect, and the parent is more likely to say or do something that's later regretted. And then in terms of thinking of how to help regulate when things are too hot, so just recognizing and labeling feelings can be really powerful. And important to realize that it's hard to acknowledge certain feelings as a parent. There's a lot of guilt, a lot of shoulds or shouldn'ts in terms of how the parent thinks they should feel. And for the therapist, it's important to normalize that it's natural for parents to feel angry, to feel depressed at times, to be hopeless or bored with parenting. And feeling guilty about that, adding that extra layer only adds to the negative feelings. And again, the principle of just watching, listening, stepping back. So always helpful to pause. This can be the opportunity to identify the feeling. And sometimes it may even be necessary to walk away if the feelings are too strong. Feelings are temporary. We know that things will pass, that things will simmer down. So it's okay to pause and wait to react. And then taking the time to think, how am I coming across, or looking at the self from the outside, to knowing that children are very sensitive. They're good at reading negative emotional cues through tone, through body language, facial expressions, and they're really strongly impacted by this. So it's important to be aware of the signals you're sending as a parent, but it doesn't mean that they will be traumatized or damaged because of this. It's just to say more so that this may impact how the child's feeling or how the child behaves, and can lead to a more disruptive behavior and lead to a cycle of escalation. So when you're noticing this happen, it's important to pause and think about, how are they affecting each other? How is parent and child affecting each other? And then for the parent, just being able to explain like, oh, I'm angry because of this thing that happened earlier today. That can really do a lot to address the child's sense of shame and make that interaction less upsetting for both. Another important one is just remembering the child is just a child. So often this happens in all relationships. We hold fixed assumptions about motivations for behavior, and often we're not even aware that we're making these assumptions at all. So for parents, it's really common to make assumptions about their child's abilities that really don't fit with where they're at developmentally. A really common one is when parents think like the child is knowingly manipulating them by crying. And of course, if that's how they feel, if they feel like they're being manipulated, if the child has some sort of nefarious purpose there, it's really easy to become angry at the child. And important to step back and remember that young children don't even understand people in such a sophisticated way to be able to manipulate. And that can also bring down that emotional intensity. And of course, always important to recruit supports. So seeking support through other relationships is vital to the parent's well-being and will benefit the child too. And then lastly, just being able to forgive child's behavior, to have self-acceptance, it's natural for parents to have self-doubts or be self-critical, and natural for them to also feel critical of their children. And it's important to accept that people are going to have strong feelings. Sometimes we will act in ways we don't like, and be able to have acceptance for ourselves, for the parent to have acceptance for themselves, and to have acceptance for the child too. And then this is an acronym these same authors use, the PARENT app, standing for attention, perspective taking, providing empathy. Again, just ways of incorporating more reflection. So first, paying special attention by showing interest, observing. This includes the body language, so turning toward the child, keeping a warm expression and tone and posture. It can seem really simple, but makes a huge difference, because taking an active interest, being curious about the child's thoughts and feelings, is how you show the child that you're interested in them and what's going on in their mind, and that this child is someone to be interested in. So perspective taking, again, we often assume we know what's going on in someone's mind, and this is especially true for parents, assuming what's going on in their child's mind, because it can sometimes be easier to acknowledge that we can't read other adults' minds, but we might think we know what's going on with a kid. It's still good to try to take a reasonable guess, but it can be really hard to maintain curiosity, like mid-tantrum. That's where it might be easier to jump to more negative assumptions, like they're trying to annoy or upset me. So going back to what we were talking about just a few seconds ago, children can't see things from another person's perspective until at least 3 or 4. We really have to think about the developmental age, and really try to back off on some of these assumptions, and remembering that there's a difference between the child's mind and yours as the parent. But all this to say too, it's not the same as accepting the behavior. The behavior itself may be unacceptable and may need discipline on its own, but it's just acknowledging that there can be feelings that are influencing them too. And sometimes we don't know what our children are thinking, and that can be helpful to say out loud. So this can be really impactful because it helps the child understand his own mind and improves the parent-child relationship and teaches them important social skills for the child, which will be valuable to all relationships. And then the last P is to provide empathy. So being able to understand and be sensitive to the child's point of view and feelings. This is adding that layer of emotional response to perspective taking. And it functions to connect the parent with the child's emotions, let the child know that the parent knows how he feels, and important to think about timing with this too, because in terms of like when the child's not ready and the child's too upset, when their emotional thermometer, when they're at that like red space or at the top, that's not going to be a time when the child is able to hear this kind of discussion. And it's also important for the parent to take their temperature, like where are they at, and important for the parent to be able to be calm. And then finally, I wanted to discuss enhancing reflection with foster and adoptive families. And so I'm really talking about this through the lens of my work with UCLA Ties for Families. Ties stands for Training, Intervention, Education, and Services. It's an interdisciplinary program that's dedicated to optimizing the growth and development of foster and adoptive children and their families. And it's a collaboration of many groups, including SAML, the Department of Child and Family Services in LA, the LA Department of Mental Health, multiple private foundations. And again, the overarching goal is to support the development of children from birth or whenever they enter foster care through age 25. And this is through education to help prospective foster and adoptive families before a child is even placed in their care. It includes support for families during times of transitions, includes clinical care. So that means therapy, both individual, parent-child therapy, family therapy, and then even psychiatric services when indicated. And that's my role within TIES. And reflective parenting principles are embedded in the work that we do at TIES in many different ways, in just promoting the growth and development of foster and adoptive children. And then one program I also want to highlight within TIES is the Infant Mental Health Program. And this is directed by Dr. Catherine Lippincott, really such an expert in infant mental health and reflective practice. And in her program, reflective parenting principles are used to strengthen the caregiver-infant bond through things like parent-child psychotherapy. Reflective supervision is incorporated into their home visitation program. So reflective supervision acknowledges the complexity and importance of all relationships in the work that we do, including the caregiver-child relationship, the provider-client relationship, supervisor-supervisee relationship, and it helps support providers in managing the powerful emotions that accompany this work, and even sees this as a critical competency itself. So these are just some really quick facts about foster care. So there are currently over 400,000 youth in foster care. And children from ages 0 to 3 account for about 1/3 of the youth in foster care. Around 50% of kids in foster care end up reunifying with their birth families. And we know there are vast disparities in the ethnicities represented among foster youth, with disproportionate numbers of Black and Latino children represented. And this could definitely be a whole talk on its own, just examining the many layers of structural racism that contribute to the staggering figures. And it's beyond the scope of my talk today. But if this is an area you want to learn more about, Torn Apart by Dorothy Roberts details the racism inherent to the child welfare system. That's the book by Dorothy Roberts. And then also children in foster care have much higher rates of adverse childhood experiences, or ACEs. So this is before they enter foster care, and then they are more vulnerable to subsequent abuse as well. And we know that higher cumulative ACE exposure is associated with a greater instability of placements for kids in foster care. And then as we think about this and how it applies to working with children in foster care and being reflective with these kids. So again, we know there are higher rates of ACEs among children in foster care. Ideally, parents help children feel safe and contained. This is how children learn to relate to and connect to other people. But when a parent is a confusing mix of safety and fear, the child finds himself in an environment where he is unable to develop skills necessary to enjoy healthy relationships. Traumatic experiences and chronic stress rewire the brain so that it's always on high alert, ready to protect against danger, whether that's through aggression, withdrawal, zoning out. And even if the child transitions to a loving family, the child is likely to be more reactive and take longer to calm. And then also thinking about like the impacts of neglect, which is one of the most common reasons people enter foster care. So those who've been neglected have a harder time discriminating emotions in the faces of others. They have a harder time understanding others. Neglect is also associated with developmental delays, motor language, with learning difficulties, with attentional and behavioral problems. And then kids who have experienced abuse tend to overrate anger and aggression when they're looking at faces. They see danger and threat even when others might think there is little evidence of this. And we know that children tend to blame themselves for negative events that happen in their lives. They're highly prone to shame or feeling like they are bad. And children who've been mistreated are at especially high risk for internalizing that they are unlovable, ineffective, helpless, or worthy of rejection. And this gets carried on even into a new home. And so it's important to know that to avoid feelings of shame, they may act tough, get angry, may come out and blaming others, denying what they've done, refusing to talk about what happened. And this does come up a lot in, I think, the work that we do in helping parents understand where some of the behaviors might be coming from. And there are also higher rates of in utero substance exposure. And I don't have time to discuss this in detail, so just some broad points. There's a lot we don't know about in utero substance exposure and its effects. A lot of the data we have are confounded by other risk factors, including the effects of poverty, lack of prenatal care, exposure to violence or trauma, the chaotic lifestyle that may surround substance use, as well as underlying psychological problems. So we can't say for certain that use of this particular substance causes XYZ in most cases. There's a mix of findings with early effects on things like gestational age at birth, fetal growth, as well as impacts on state regulation, so behaviors, as well as emotion regulation. But we know that some, but not all, exposed children will demonstrate difficulties, and a nurturing and stimulating home environment is healing. So with appropriate supports, these children who've had in utero substance exposure can do well in foster and adoptive homes. And then a number of studies have examined how adoptive and foster parents can help their children work through earlier traumatic experiences. And interestingly, how well children adjust in adoptive families is found to be dependent on how sensitive their adoptive caregivers were in terms of their thoughts, feelings, and perspectives. So another way of looking at that, the more reflective the adoptive caregiver was, the better the child appeared to recover from earlier experiences. And so when we think about how resource parents, so that's adoptive and foster parents, how they can support the child, the same principles of reflective parenting become even more important. So keeping in mind the parent's, child's, and family's emotional thermometer. So that's the awareness of how the parent feels, how the child feels. This becomes that much more important with a child who has had traumatic experiences, when the child is in a constant state of alert and expects negative things to happen. And it's that much more important for the caregiver to be aware of how they come across, to be able to see themselves from the outside, and to lower their emotional temperature. It can be helpful for the caregiver to remember that they are not to blame for the child's problems, to find connection with other resource parents, and to remember that change doesn't happen overnight or even in a week or a month. And to remember that when the child is feeling really intensely upset, this is not the time to try to reflect. But giving space or offering a distraction may be more helpful. And then in terms of like the family's emotional thermometer, just thinking about, how is the household overall? Is everyone anxious? Is it unpredictable in the house with people dropping in without notice? All of these things will impact the child. And then an emphasis on creating a shame-free zone. The children who have been traumatized are especially sensitive to shame. Without a positive view of themselves to fall back on, they become overwhelmed with the feelings that they are bad. And this is a feeling they want to avoid at all costs. So it becomes that much more important to avoid using blaming and judgmental language, to lead with empathy and support. And then after misunderstandings, just look for opportunities to reconnect as soon as possible. Also, for a sensitive child, perspective taking is that much more important. It may not be obvious why the child acts a certain way. The child may have a hard time understanding himself. And as the caregiver, it's even more important to put effort into seeing the world from the child's perspective. And then create an environment of curiosity. So often kids who have not had the experience of a parent who has been interested in them, or maybe they've had the experience of a parent who misunderstood them, it will be particularly hard for this child to be reflective. And looking inward can even be a scary experience. So the caregiver can help by being really explicit about their intentions, really pointing out their own mental state, something like, I made you this lunch because I care about you. And also encouraging the child to explore their own mind, being sensitive to the child's propensity for shame. So sometimes an easier way to start here would be to explore positive feelings or positive actions. Something like, oh, how come you gave your toy to your sister? Really highlighting something that was positive and trying to help the child understand himself in that way. And also really want to emphasize the importance of celebrating resilience. So children who have survived adversity face extra challenges, and they also have incredible strengths and resilience. And it's important to highlight this and celebrate this as it helps build a more positive view. It builds confidence in their strengths and abilities. And then it's important for the caregiver to celebrate their own resilience too. So it can be very overwhelming to be a parent, and especially to parent a child who is highly sensitive, one who's had a lot of adverse experiences, and it's easy to lose sight of all the things that they're doing well. So a little more just terminology related to foster care. So concurrent planning refers to working toward family reunification while simultaneously developing an alternative permanency plan. So the first choice for most foster children is for them to return home to their birth families. And that requires that the caregiver be able to demonstrate to the judge that they can provide a safe home for their child. But if it's determined that if the judge determines the child cannot safely return home, you have to think about other federally approved permanency goals. So that could be placement with a fit and willing relative, kinship care, the adoption by a foster family, the legal guardianship, like a permanent legal custodianship. And the goal with working toward both these things at the same time is to honor the child's attachment needs, to expedite the permanent home for the child, because with earlier placement, we avoid having multiple placements where they have to shift between multiple different homes, provides greater continuity of relationships for the child. And the idea is that the adults are the one who take the hit. And that obviously can be a challenge for families who are fostering with the intention or with the goal of adopting, because their goal of adoption then conflicts with a case plan of family reunification. And this was all part of the Adoption and Safe Families Act, which was signed into federal law under Bill Clinton in 1997. So this really impacts some of the considerations that we have for resource parents. Again, that's foster and adoptive parents when we think about reflective parenting. So concurrent planning, again, working toward family reunification while developing an alternative permanency plan, poses a challenge for families who want to adopt. There's this conflict between their desire to adopt and that goal of reunification. There's inherent uncertainty. There can be the fear that the child might be removed. And this creates this tension for the parent between self-protection and then wanting to meet the child's needs. Because as we know, that relationship is really vital to the child's development. But sometimes there can be this desire to self-protect, to defend against becoming too attached to a child who may be removed. And in thinking of this, it's also important to acknowledge previous losses of the resource parent. So not uncommonly, some people who become resource parents may have had their own difficulties with infertility, with pregnancy losses, or even having lost a child before. And so keeping that in mind in terms of how vulnerable they might feel or how their desire to protect themselves then. And when reunification is expected or it does occur, this can trigger previous losses. There can be disenfranchised grief. So grief that's not really acknowledged by society, but for the resource parent, it is a major loss after having bonded and fallen in love with a child to have to lose this child. And there can be this ambivalence regarding the child's possible return to their birth family. And then the psychological clock ticking. This is the idea that they may be eager to adopt, but unable to take on another child while they're in this place of uncertainty or awaiting imminent reunification. And then this last point, the desire to provide a child with a better life is obviously a very caring motivation. But I bring it up in the sense that it can also lead to expectations of the child or wanting to see the child demonstrate that their life is better. But that doesn't always fit with the child's healing process and development. And the transition into even a very loving home can be very difficult, especially in the early periods, but later on too. And that healing might not be linear, can come in different patches. And that can be hard for the resource parent to reconcile with the life they had hoped to provide for the child and raise feelings of anger or inadequacy, self-blame, hopelessness even. And this is a quote from a recent memoir, Safe, by Mark Daly. So a memoir of becoming a foster parent. And he said, if Ethan and Logan, whom it had taken all of 1 second to fall in love with, weren't going to be ours for life, I wanted to know, was our job to watch them for a short while, or should we be saving for their education? I wouldn't love them any less or be any less devoted to their care. But if we know, I thought, we could protect ourselves. We wouldn't allow ourselves to dream of our future life together. Teaching Ethan to throw a baseball or sharing my love of skiing with Logan, trying to accept that we had no knowledge of or control over the outcome was torture. Or an anecdote that I think of from Dr. Lippincott in our infant program. She'd worked with a family who had fostered a baby and ultimately adopted this child years later. And only after the adoption was finalized did the parents realize that they had hardly taken any photos of the baby. And the ones they had didn't include themselves, the parents. And at that point, it really struck them how there was such an intense fear of becoming too attached because they were so afraid of losing this child. And so thinking about how we can support resource parents, so it's important to provide space to explore their reactions and emotions, to provide validation and acceptance of their experience, acknowledging that strong feelings are normal, acknowledging the difficulty of uncertainty, normalizing fears, frustrations, and tensions that arise in the process of raising a child, of navigating bureaucratic social infrastructures, or interacting with the birth family, and really natural to be worried about becoming too attached. It can be helpful to identify strategies for being present in the moment with the child, to enhance opportunities for joy and mutual delight, and to provide psychoeducation and reflect on the positive impact of stable, loving, how a stable, loving, stimulating relationship provided by the resource parent is so vital for the child's development. And so finally, just a few take-home points. So a few pearls from reflective parenting. So the parent-child relationship is paramount. Perfection is not possible or necessary. Always important to start with curiosity, to reflect first, and then react. And applying this to foster and adoptive families, and that children who have experienced mistreatment require even greater emphasis on reflection and recognition of their resilience. And resource parents face a challenging system and great uncertainty in their roles that can challenge attachment and reflection. And mental health providers can provide much needed support toward enhancing reflection in these families. And that's the end. I think it took up more time than I expected. But thank you everyone for your attention.
All right, thank you so much, Dr. Manegold. That was wonderful. There are so many tidbits in there. I heard things about expectation bias, about parent modeling. There was a lot there, and I hope folks are able to get these slides or look over this recording to fully digest all the wonderful stuff that you shared today. As folks know, there's a Q&A open, but I will start off with one question, which is, we hear a lot about gentle parenting these days, and I think people generally think of it as kind of a positive direction in terms of our discourse about parenting in the lay public. But I'm curious about, what are your thoughts about gentle parenting? How does it relate or not relate to reflective parenting?
Yeah, I definitely think there's a fair amount of overlap, and a lot of what I've seen, at least in gentle parenting that's come up in social media, seems to really emphasize the importance of empathizing with the child, of being able to help them develop those emotional regulation skills by verbalizing their feelings, by helping them process. Sometimes what seems to be missing, at least from what I've seen of it, is more the side of reflecting on the parent side, of being able to incorporate that. And one of the criticisms that I see come up a lot is this idea that discipline is not allowed, which at least is not the case in reflective parenting, where there is an expectation that there's conflict, that children must behave, that it's still important to respond to those behaviors and to set limits. I think the other part with reflective parenting is also the importance of, after setting the limit and after discipline, being able to be authoritative and then also remain warm and still reconnect.
Awesome. I'm hearing that, like, having those boundaries, those high expectations, in addition to the warmth that gentle parenting emphasizes. And then also, as you briefly talked about, the repair after. So, when there are moments of conflict or people not being on the same page, being able to come back and repair that relationship. Awesome. Another question, so I'm waiting on the Q&A here. Another question I had was, you had mentioned some of the things that can get in the way of reflective parenting. And as someone who often thinks about things on a wider scale, or broader scale, I'm wondering what social factors you may think of. I know you mentioned sleep, you mentioned the importance of parents getting external support, but are there other social factors you consider, poverty, so forth and so on, we should think about?
Yeah, absolutely. And you're right, I didn't go into that as much, but absolutely poverty will affect where the parent is coming from, or just not having any sort of social supports, living in a society where we don't have social infrastructure that really takes care of parents and supports parents in terms of being able to take leave from work, or being able to support parents who are in a society where it's normal to have multiple jobs, and thinking about that added strain on a parent, that's going to be really taxing. We know that things like being emotionally exhausted, sleep deprivation are going to affect our reflective function. And when we don't have the infrastructure to help support parents in being able to care for themselves, then that is really difficult. And we also think about a higher burden of like adverse childhood experiences among people who grow up in poverty, where they might not have had these positive parenting experiences either. it's going to be extra difficult to be able to implement more positive parenting when they are parents themselves.
Thanks for speaking to that. I really think it gets to, that idea of thinking about how one is parented and how reflective parenting really brings that to mind. And I think also to your point that you're bringing up, there's the supports for families that are necessary. I think we often think there's no such thing as a baby, and then I like to think there's no such thing as a family. We need those extra supports for family. They don't live in isolation. So,
Absolutely.
awesome. I know we're at time, and I see one question in the chat that from Dr. Richards. She asked, I really loved how you discussed the 3 R's from Bruce Perry. Do you think this is specific to parents, or can it be generalized to all interpersonal exchanges?
Oh, thanks, Misty. And I think I learned the 3 R's from Misty Richards, so thank you. And absolutely could be generalized to all interpersonal exchanges. I think about this often in our interactions too, when we're working in just any emotionally difficult situation. It can be particularly important in the work that we do as mental health providers to be able to regulate, relate, and then reason. Thank you. I know we went over, so thanks everyone for staying.
All right. Take care, everybody.